Hello and welcome to Health Professional Radio. Thank you for joining us on the program today. I'm your host, Neal Howard. Our guest in studio today is Mr. Nathan Cheong. Nathan has more than 13 years of experience in the complementary medicine industry as Managing Director of BioCeuticals, the largest physician-only complementary medicine manufacturer and distributor in Australia. And he's here today to discuss with us his approach to health and the importance of practitioner advice along with therapeutic supplements. Welcome to Health Professional Radio, Nathan Cheong.
Thanks for having me, Neal.
Thank you. You've got a lot of years of experience in the complementary medicine industry. Were you always in the complementary medicine industry?
Well, I've been in the complementary medicines industry, as you said, for probably it's more like 20 years now. Okay. I think 13 years as a managing director and general manager, and prior to that, I was a practitioner for around 7 to 8 years. So. Have I always been in the complementary medicine? Not necessarily the complementary medicine industry. I have got a background in psychology and social work, and worked in the hospital system here in Australia as a social worker and psychologist. And prior to that, though, my approach to health has been, I guess, hasn't always been as holistic as it should have been. Mm-hmm. And whilst I have my parents to thank for introducing me to naturopathy and introducing me to naturopathic practitioners as I was growing up. And for the Australians who are listening, they would remember Dorothy Hall, and Dorothy Hall was my mother's. She was the mother of naturopathic medicine in Australia. She was my mum's practitioner, and she took me to see her as well. So I've been exposed to it. I then, I guess, re-engaged with naturopathic medicine as I was getting, around my mid-20s, late 20s, and it really opened my eyes to what could be possible with naturopathic intervention and a holistic approach to people's health. And so I've been, and that's really what tweaked my interest, and I started studying a little bit and got deeper and deeper involved, and really it kind of, it sucked me in to the point where I went and completed my studies in naturopathic medicine. In Australia, we do we're advanced diploma of naturopathy, and then you can convert that into a degree through a Bachelor of Health Science, and that's what I did. And so that has sort of got me into my clinical practice. And I practiced in a clinic. I also had a health food store which I practiced out of, and then I moved into the corporate space of complementary medicine, where I felt that I could make an even, or not so much more of a difference, but certainly bring a different approach to the complementary medicine industry.
Are the differences between a naturopath and an herbalist small differences, or are there huge differences in the two?
No, they're very, very small. In fact, naturopaths will study herbal medicine through their training, and so they will get a 3 years worth of herbal medicine training. A herbalist might also do an extra couple of years of herbal medicine, so they might go on and do advanced herbal medicine, or they might go and do a master's in herbal medicine. The difference is really between herbalists and naturopaths in Australia is with regards to herbalists don't study nutrition. So within their training, they are predominantly focused on the symptomatology, diagnosis, and pathology. They do herbal medicine, they do anatomy and physiology. So they do all of the hard sciences, and then they complement that with herbal medicine. As in naturopathy, we also supplement with nutrition and nutritional studies as well. We touch on a little bit of homeopathy and body work.
Now, do you subscribe to an integrative approach as far as traditional pharmaceuticals and these natural remedies?
Yeah. I think it's really important to note that our allopathic medicine GPs, physicians have a very important part to play in people's health and wellness, and therefore, a lot of our customers, a lot of our healthcare professionals who are customers of BioCeuticals treat very much in an integrative way. So they they will, they have a traditional approach to their patient, but they then subjugate that with, I guess, a philosophy of holism, and understanding that we aren't just treating the symptom, but we need to go to the cause, and we need to understand the root cause, and then support that person on their health journey through naturopathic medicine and herbal medicine and the other modalities that they may practice. So an integrative approach for myself is taking a combination of areas of expertise in that healthcare professional's toolbox and applying those appropriately. It also might mean that they work with other specialists in their areas, so they might work with a cardiologist or a neurologist, but at the same time that they have a very healthy relationship with those other modalities and specialties that they're working with, to ensure that they pass that information backwards and forwards. So always at the centre of the care is the patient. So the patient isn't just a condition; the patient is a person first and foremost. And our job as healthcare professionals is to ensure that we align the best modalities to ensure that person's health and wellness is at the centre of what we're trying to do, which is really what I consider to be personalised medicine and the practice of personalised medicine.
You worked in a hospital setting with traditional practitioners. What type of reception did you receive when dealing with the importance of advice from practitioners who may not be naturopaths or herbalists, who, as here in the United States, not getting a lot of training or any training at all in nutrition, much as an herbalist? Being on staff there in a hospital, in the traditional sense, what type of reception or interaction, in your experience, occurred?
Well, it's little to no interaction is the short answer. Whilst I was finishing my training as a naturopath, I had the opportunity to work in a mental health setting. So this was a chronic mental health institution where patients were, they were experiencing acute mental health episodes. They were hospitalised for short periods of time. They had their treatment stabilised, and then they were put back out into the community. That was kind of at the front end, and then there was some medium-term sort of care, and then some long-term care. And the most important thing for me was that the nutritional status of these individuals who have suffered from acute mental health episodes, chronic mental health episodes, in and out of hospital settings, were just the nutrition of these patients, unfortunately, were really, really poor. And so bringing up, from my perspective, whenever I was in a setting where we would talk about someone's case, and I would bring up the person's diet, their lifestyle, and potentially other interventions around, vitamin therapy. It was always, received courteously, but definitely there wasn't a willingness to look at this in any serious light. So whilst that was my experience in that particular hospital, I can't necessarily draw any conclusions across the rest of the traditional hospital network. But I do know that there are some really good work. There's some really good work being done in pockets of around Australia in hospital settings that are treating people with cancer. And so they're recognising the importance of nutritional health and wellness interventions around meditation, mindfulness, herbal medicine, nutritional therapies, ensuring that gut is incredibly healthy. And they're really, in my opinion, this is where we need to be. We need to be looking at, and we need to be holding these centres up as real trailblazers. And these guys who are being incredibly brave by tackling this are really getting some really good benefits for their patients. And the proof is always going to be in the pudding. And it's these patients who their quality of life improves through treatment. Their outcomes start to improve, and there are a lot of different clinical trials and research that's being done in these institutions that are demonstrating the benefits of a holistic approach to a patient's care. And I keep coming back to that holistic terminology, and what I mean by that is that the patient is not the disease. We're not talking about someone with, John with cancer. We're talking about John who happens to suffer from a cancer, but we are most interested in John as a person and how we can actually get him well and optimize his health.
And not just worrying about John as the disease. I get that.
Absolutely. Yeah, that's right.
Well, thank you. Thank you for coming in with us today, Nathan. It's been a pleasure. I'm hoping that you'll come back and speak with us in some other segments.
Yeah, that'd be great.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with Mr. Nathan Cheong, Managing Director of BioCeuticals, and he's been in studio with us talking about his approach to healthcare and the importance of practitioner advice alongside therapeutic supplements. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.